Hello there. Yes, I'm Dr. Brown. Dr. Undead told me that you were coming over here. Fortunately for you, it's a very slow day. Um, he has informed me that he did an EKG on you earlier today. Is that correct? Yes. Okay. And I actually have it right here. And what I want to show you. I'm very sorry. This seems rushed, maybe, but wasn't. I was actually about to head out since no one was showing up today, and none of my nurses or any of my staff has decided to show up. So I just got here just a few minutes after you. Alright, I'm sorry about that. He called me on my way home, but that's fine. It's fine. I should know better than trying to cut out early. Well, that's true. What I want to show you here is he faxed over the the EKG results, and you see how this line here, the way it dips like that, how it goes down right there. It's showing me that there is something wrong with the electrical pathway in your heart. It's nothing to be super concerned about right now. From the EKG alone, it looks like a condition known as WPW, which is a somewhat common condition where people have an extra conductive piece of tissue on their heart. Yeah. Well, it does sound like that would be good, but the problem is that an extra piece of conductive tissue can actually cause. Let me let me draw this out here for you. All right, where is my pen? Hold on. There we go. All right. Now, what I'm going to do here, I'm going to draw you a diagram of your heart. And this is going to be a little cartoony heart. Okay. And you have this conductive pathway here on your heart. Now, what that does is it allows the electricity that pumps your heart to travel from the top part of your heart to the bottom. Okay? Now, when you have an extra pathway there, like this, sometimes that will try to go down that pathway instead. Now, that pathway, when that happens, it might actually try to go down both. When that happens, you get a heart palpitation. Okay. A lot of times people don't know that they've had heart palpitations, and sometimes people can tell that they've had them. It just matters how sensitive you are to sensations going on with your heart. Yeah. So, have you ever felt a lightness in your heart? Kind of like a fluttering feeling in your chest. Okay. All right. So, only whenever you have very little sleep and caffeine, or both, like, okay, so either or. Okay, I understand what you're saying now. Well, here's the thing. We can't know for sure without doing an echocardiogram. Have you ever had echo done? Um, have you ever seen in movies when a pregnant woman goes to the doctor and they do an ultrasound on her belly to look at the baby? It's pretty much the same thing. In fact, it is the same thing, except for just doing it to look at your heart. We can do that to look at other organs and your arteries and all sorts of things. It's just projecting sound waves into your body so we can get an image back. Yes, correct. Yeah. So, what happens is that shows us that at least that your heart hasn't become weak. Well, it is a very big possibility, very small chance that your heart can become weak from having WPW. Yes. Well, from the echo, we can gather your ejection fraction rate. Well, the ejection fraction rate is pretty much how much blood your heart pumps. And the average person's heart pumps 55% of the blood that they have each time it beats. Okay. I do want to go ahead and ask you, um, have you had like a dry cough? Have you had pneumonia or bronchitis in the last 5 or 6 months? Okay. So you had a bronchitis how long ago? You're not exactly sure. Were you diagnosed or self diagnosed? Self diagnosed. Okay. Um, what? Oh, see, the purpose of needing to know that information is that if your ejection fraction rate is too low, blood will actually begin to back up and spill over into your lungs, and that is known as congestion. And due to this, it's congestive heart failure. No. Heart failure doesn't mean that your heart has just given out. It just means your heart's weak. Yeah, I agree. The wording is ridiculous, but I didn't come up with it. So there's nothing I can really do about it. Yeah. Are you feeling all right? Okay, I don't want you to be worried right now. All this is speculation, and I just want to be very open and honest with you. Okay, well, I'm just a little concerned. You're starting to look a little pale. Yes, it all sounds like a whole big lot, but if it is WPW, you have choices. Well, I mean, it also depends on how aggressive it is. Well, I hate to use the term aggressive. That makes it sound like it's cancer and then it's attacking you. It's nothing like that. It's just if there is any immediate danger, we can judge that from looking. Yes, that's correct. Well, You know what a heart cath is? Okay, that is where we can go in through your groin or your armpit and go in through one of the major arteries and go to your heart and look around to see if that any of the structures are not functioning the way they need to be. Well, if I had to, I would be the one doing it. Well, I am a cardiologist and electroanesthesiologist, so yes. That means I specialize in the electrical functions of the heart as well. Yeah. Okay. Well, I don't want you to be too worried. There are people who live very long lives with WPW and don't even know that they have it. Well, it's not something that you develop or get. It's actually a birth defect. Yeah, so you've had it all this time and you didn't know it. Correct. You could live a long life up into your 70s and 80s and never really know. Exactly. Yeah. All right. I mean, there are instances where it can be a little dangerous, but oftentimes we can take care of that with what is called an ablation. Yes. Well, that's basically the heart cath procedure, but we go into your heart and we look on a monitor and we watch the utensils around your heart and we ablate or burn away the wrong piece of conductive tissue. And we burn away the birth defect. 98% of people who have this done are perfectly fine. The other 2%, it depends. Each case is different, but often we'll get them a pacemaker. Yes. Modern pacemakers are not as limiting as they used to be. But right now, that is questions where we're jumping the gun. I haven't even done the electrocardiograph on you yet. I'm sorry, I said the wrong thing. The echo. I don't even. Okay. Yeah. Well, an echo is you're liable to fall asleep during it. They're very relaxing. And the only thing is that you might be a bit uncomfortable because you have to lay without your shirt. And since no one else is here right now, if I do it today, it'll be me, and I will be sitting there with basically one of those wands that you see in the movies that they take over the pregnant lady's belly, and I will be running that around your heart. Yeah, correct. I want to get images of complete images of your heart. Yes. All right. Are you sure you're doing all right? You were looking really pale, and like I keep saying, it'll be fine. It will be fine. Now, do not be scared right now. There's nothing to be worried about. It could have been a glitch on his machine that showed the EKG. His machine is very old. I've tried to get him to get a new one for a long time. He does do that. In fact, your appointment here today is not going to cost you or your insurance anything. Well, he knows, he has his list of doctors. Yeah. So don't worry about it. There you go. You're getting a little bit of color back in your face. So I'm glad that, the lack of financial loss. I'm sorry, that's a double negative, isn't it? Well, I am a doctor, not a English teacher. Yes, so what we'll do is, the course of action is to, like I said, do the echo on your heart, get a full image of your heart, and I want to see just exactly what your ejection fraction rate is. Well, like I said, our goal is at 55%. Really, anything below that is within heart failure. It is possible to get out of heart failure once you're in it. And normally it's a lot of medications and the corrective procedure. Yes. Well, I mean, there's no need to, right now, worry about getting a second opinion. We have no idea yet if this is the case. Yes, I still have yet to look your heart over. Yes. Okay. Yes, I know it's a lot of information. It is all very scary because anytime anything happens with your heart, no matter what, even if I'm sitting here telling you how trivial it can be, it is your heart, and it can be very scary and shocking. Exactly. Just as important as the brain, yes. I would almost say more so important than the brain. Because without it, how's your brain getting the oxygen? But of course, I'm sure if you spoke to a neurologist, they would tell you the brain is still more important because the brain tells the heart when to beat. So, heart cancer. Who told you that? Did Dr. Undead tell you that? No. Then why are you worried that you might have? Oh. Well, that's something you should be scared of. Yes, looking at WebMD while you're driving is very dangerous. In fact, doing anything other than driving while you're driving is really dangerous. And in fact, WebMD will make you a hypochondriac. Yes. So I believe their first response to anything is it's a cancer of some type. That is correct. So, well, I do believe it's good to be informed to a certain extent. And that makes it sound like I'm saying knowledge up to a certain level, but when you have so many options available for what could be causing your symptoms, what could be causing this line dip the way that it is on your EKG. There are many things that could cause that. And it seems the purpose of the internet to diagnose things is to give you the worst possible answer first. I'm sure if you look up about WPW and you don't find like a site with other people who have ever had it, or just, maybe look it up on WebMD and you're going to find some horrific stuff. But I assure you, it's a condition that a lot of people come in here with every day. Some of them don't even get it fixed. That's correct. And I would prefer to fix it, because there is a very small chance that you can get to being older, in your 50s, 60s, 70s, and have an episode and be given the wrong medication because they think you're having a heart attack, and it could make the episode worse. But fortunately for you, you're young, so if you have an episode with your heart, a lot of the times, you don't smoke, correct? And you drink very little. And I know in your file it said that you don't use any recreational drugs, so there is no reason to believe that you would just up and suddenly have a heart attack. So if something was to happen and you passed out, once they got you to the hospital, we would look and we would see in your file, whoever was working at the hospital, working the emergency room, would look and see in your file that you have no factors that normally lend itself to a heart attack. Yes, so, and then normally they would just work on trying to get you stable and then send you to me. So, no, I don't think you're going to pass out from that. What I do think you're going to pass out from is the fact that you keep asking so many questions, and I keep being incredibly honest with you. Yes, because every time you have asked a question, and I have explained it to you, you've gotten more and more pale. I'm pretty sure all the blood has drained from your face. Yes, it is very scary, but I don't want you to worry. Worry does no good. Exactly. Worrying has never solved a problem. Exactly. So, okay. Well, so you don't want to do the echo today. It can take anywhere from 15 minutes to about 30 minutes. Well, that's understandable. Yeah. So like I said, I wasn't expecting to have a patient come in at the very end of the day anyways, and I'm sure it's very frustrating for you not to expect to have to travel so far. I'm very sorry about that. Well, I'm glad it's not that far. Well, I just want to reassure you, I don't want you to go home and worry that, you're going to die in your sleep or anything. Yeah. Until we do the echo and see if there's any reason to do the heart cath. This is just a bad EKG. Okay? You know, not like bad as in like it's going to kill you. It could just be a misreading of the machine. I honestly think he has had that EKG machine for at least 30 years. Yes. Yeah, it's very old. I think he had it before I went into practice. I think it was handed to him. It was a hand me down from another doctor that he knew. Yeah. One day I'm going to have to just get him a good one. We have some here in the office, and it's getting close to time for us to have to order some new ones. So I'm sure he will be very appreciative to have at least another one laying around. If he'll actually use it, that's another question. Well, I mean, short in one of the leads. You remember when they snapped all those things on you? Yes, on your ankles and your arms and your chest. Yeah. Yeah, there's a lot of wires, and the problem is that if there is a short in one of them, it can give us a false reading like this. Yeah. Or if you moved, you might not even have noticed moving. Yeah. Yeah, I mean, breathing can do it. I'm sure he told you to hold your breath before he did the scan, but sometimes, sometimes we just have to breathe. I mean, that's part of being human. I think that's part of being any sort of oxygen breathing organism on this planet. Sometimes you just have to breathe. Yes. Well, what I would suggest is that you don't really worry yourself about it. It's good to be cautiously optimistic when you get news like this. So um, be optimistic about it. It could be nothing, but if it is, it's most likely something that isn't really going to affect you. Yeah. Well, I mean, it's much better than, cancer on your heart. It's much better than cancer anywhere in your body. Yeah. All right. Well, I tell you what, if you really want to wait, you can wait to have it done. I mean, it's not like you're going to drop dead. Exactly. Well, you made it. You made it a week. Um, and you just moved over that way. That's one way to start off your new life, isn't it? Well, I hope when you come back in about a week, 2 weeks, which one would be better for you? 1 week from today or 2 weeks from today? Okay, so when you come back in about 2 weeks, um, hopefully we just find out that it was a bad EKG and your cardiac functions, your ejection fraction rate, I'm sorry, is in the normal range, and that we can just go on. Well, it is possible to have palpitations with caffeine, and I've heard of people who have palpitations when they're tired. That's why it's very important to make sure you get the proper amount of sleep. Yeah. And exercise. Exercise will help. It's very important. Yeah, well, I mean, we're now finding out that just sitting is almost as bad as smoking. Yeah, it's scary to think, you know, all this time we've all been sitting, especially as computers become more advanced and we're in the age of television right now. No, I have not watched Game of Thrones. That's what people keep telling me. They keep telling me that it is good. I would say every third patient I see tells me it's a very good show and I should watch it. Yeah, that's correct. Well, do you have any other questions? All right. Again, just go home, live your life like you normally would. Don't worry yourself. It will be fine. Yeah. I mean, if for any reason that you don't feel good, you can just come into the emergency room. Um, Tell them Dr. Brown sent you, and well, not that I sent you. Tell them that they can contact me, and they will. All right. All righty. Well, I hope you have a good day. All righty. Have a safe trip back, and no more looking up things on your phone while you're driving. That's more dangerous than anything right now going on from this one EKG. Yeah, do not text and drive. That's like, I believe, 4 times worse than driving drunk. I'm not 100% sure on those statistics, but I think that's how it works out. All right. All right. Well, you have a good day.